Hello, everyone. Thank you for joining us for our fourth installment of the Root Cause Coalition's 2017 webinar series. Before we get started, I wanted to run through a few features of our webinar today. All of our attendees will be in listen-only mode for the duration of the webinar. At the end of our webinar, our panelists will be answering audience questions. If you have a question during the webinar, please type your question into the question pane on the webinar control panel located at the right side of your screen. This webinar is being recorded and will be available for download on the Root Cause Coalition website later this week. Thank you all again for attending, and at this time I'm going to pass it over to our presenters.
Very good. Hello, everyone. This is Gary Vessels. I'm with the Food and Nutrition Service, or FNS. Thank you for joining us today. Next slide. Just a few short words about FNS in general. This is our vision and our mission, and as you can see, our mission is to increase food security and reduce hunger. And we do this in a way that supports American agriculture and inspires public confidence. Next slide. In the first two bullets, you see a big part of what we're faced with. Too many people who are food insecure and a high obesity rate for adults and children. Almost 13% of households in the U.S. and about 17% of children are clinically obese. I'm sorry, that was more than a third of adults. To help solve these problems, we administer 15 federal nutrition assistance programs. The largest of these is the Supplemental Nutrition Assistance Program, or more commonly known as SNAP, but they also include the Special Supplemental Nutrition Program for women, infants, and children, more commonly known as WIC, which we'll speak about more depth today. There are also the different child nutrition programs, food distribution, and we have an Office of Food Safety. We do this in partnership with state and tribal governments. Spending last year for FNS was about $102 billion. And before I speak about WIC, I'll first briefly discuss some other programs. Next slide. Listed here are the different child nutrition programs. They're administered by state agencies, and FNS reimburses them for meals served. The largest of these is the National School Lunch Program. About 30 million children participate in the program every year. About 14 million children participate in the School Breakfast Program. In the Child and Adult Care Food Program, more than 4.4 million children and 130,000 adults receive nutritious meals and snacks each day. There's also a special milk program and a fresh fruit and vegetable program. Next slide. I want to point out the Summer Food Service Program, which reimburses local organizations, schools, local government agencies who combine a feeding program with a summer activity program for children. The Summer Food Service Program ensures children ages 18 and younger in low-income areas continue to receive nutritious meals during the summer months at no cost to the household. Last year, the program served over 179 million meals at over 50,000 summer meal sites nationwide. Next slide. By making a healthy diet more affordable, the Supplemental Nutrition Assistance Program, or SNAP, promotes nutrition and health, combats hunger, and supports the economy. The program is administered by state and local offices, for example, a local Department of Social Services. It also provides benefits not in cash, but on an EBT card, and that card is used for allowable foods at authorized retailers. In 2016, the program reached over 44 million individuals in almost 22 million households. They are the most vulnerable amongst us. Typically, nearly 2/3 of SNAP participants are children and elderly or had disabilities. 44% of participants have been under age 18. Next slide. This brings us to the Supplemental Nutrition and Safety Programs, or SNAS, which includes 2 divisions and 1 office. You have the Supplemental Food Programs Division, which is where you can find the WIC program. There's also a Food Distribution Division, and I already mentioned an Office of Food Safety. SNAS administers the programs you see on the slide. I'll return to the WIC program in a minute, but first, the USD Foods Program provide over 200 domestically produced high-quality foods for use in the child nutrition programs and others. There is a senior farmers market, which provides vouchers to eligible low-income elderly people to purchase fresh fruits, vegetables, and honey at farmers markets and roadside stands. As you can see on the slide, WIC also has a farmers market nutrition program. The Emergency Food Assistance Program distributes foods to food banks and other emergency feeding organizations. And the Food Distribution Program on Indian Reservation does, as its name suggests, provides food directly to low-income households living on reservations. Finally, the Commodity Supplemental Food Program provides food packages to low-income elderly people. The program works to improve the health of low-income older adults at least 60 years of age by supplementing their diets with nutritious USDA food. Next slide, please. This brings us to the WIC program. WIC serves as an adjunct to good health care during critical times of growth and development in order to safeguard the health of infants, mothers, and children at nutritional risk. The program provides food benefits, breastfeeding support, nutrition education, and referrals to other public assistance programs and services. FNS provides grants to WIC state agencies. Per federal regulation, WIC must be located in the state health department or its equivalent in each state. There are 1,900 local agencies and about 10,000 WIC clinics, and there are also about 45,000 authorized retailers. In fiscal year 16, there were about 7.7 million participants in the program, and almost half of all babies born in the United States participate in WIC. The budget was $6.35 billion last year. Next slide. As part of its mission to improve the health of its target audience, the WIC program has long provided breastfeeding promotion and support services for pregnant and postpartum participants. WIC mothers are strongly encouraged to breastfeed their infants unless medically contraindicated, as it provides positive health benefits for both the mother and her infant. WIC mothers receive follow-up support through peer counselors. They can participate in WIC longer, that is, up to 1 year postpartum. They receive an enhanced food package, if exclusively breastfeeding, and they may receive breast pumps, breast shells, or other nursing supplements to help support the continuation of breastfeeding. WIC state and local agencies are required to create policies and procedures that ensure that quality breastfeeding education and appropriate support are provided to assist mothers in initiating and continuing breastfeeding. Loving support makes breastfeeding work, more commonly known simply as Loving Support, is USDA's National Breastfeeding Promotion and Support Campaign. It was launched in 1997 and serves as the foundation for breastfeeding education, counseling, and promotion efforts in the WIC program. Based on a social marketing approach, Loving Support is a national effort to promote breastfeeding to WIC participants and their families by emphasizing the concept that the support of family and friends, the healthcare system, and the community are all essential for a breastfeeding mother to be successful. WIC addresses challenges mothers may experience in reaching their breastfeeding goals by providing comprehensive, up-to-the-date, and culturally appropriate breastfeeding anticipatory guidance and counseling, as well as providing mother-to-mother support through peer counseling. Peer counselors are recruited and hired from WIC's target population of low-income women and undergo training to provide mother-to-mother support. Research shows that this unique mother-to-mother support can improve breastfeeding initiation and duration among low-income women. The difference between breastfeeding rates among all women versus WIC participants has narrowed. WIC's strong policy and operational emphasis on promoting breastfeeding has resulted in a steady rise in WIC breastfeeding rates. According to the CDC, between 2002 and 2013, the percentage of all U.S. children who were breastfed increased from 71% to 81%. Over roughly the same period from 2002 to 2014, the percentage of infants participating in WIC who were breastfed increased from 48% to 69%. Next slide, please. The WIC program is designed to serve certain categories of women, infants, and children. Therefore, the following individuals are considered categorically eligible for WIC: pregnant women, postpartum women, breastfeeding women, and of course, infants and children. Infants up to the infant's first birthday and children up to the child's fifth birthday. Applicants must live in the state in which they apply. Applicants served in areas where WIC is administered by an Indian tribal organization, or ITO, must meet residency requirements established by the ITO. To be eligible for WIC, applicants must have income at or below an income level or standard set by the state agency, or be determined automatically income eligible based on participation in certain programs, such as SNAP or Medicaid or temporary assistance for needy families. Applicants must be seen by a health professional, such as a physician, nurse, or nutritionist, who must determine whether the individual is at nutrition risk, either due to a medical-based or a dietary-based condition. In many cases, this determination is done in the WIC clinic at no cost to the applicant. However, this information can be obtained from another health professional, such as the applicant's physician. Finally, at the bottom of this slide, you see the link to the WIC pre-screening tool, which is a web-based application intended to help potential WIC applicants determine if they are likely to be eligible for WIC benefits. Users who are likely to be eligible are provided with state-specific contact information and are encouraged to make a certification appointment with their WIC local agencies. Next slide, please. WIC really makes a big difference, and in many ways, the program improves the diets of pregnant and postpartum women. It also increases the duration of pregnancy and reduces low birth weight rates. It reduces fetal deaths and infant mortality and saves money by preventing costly health problems. The program decreases the incidence of iron deficiency anemia in children and significantly improves their diets. It also improves the growth of at-risk infants and children. Next slide, please. The URL you see here is to the homepage for WIC. The website includes lots of great information, like state agency contact information, and that includes toll-free numbers for many states. It's a great place to start to learn more about this program. And next slide, please, the last slide. No, second to last. Finally, I wanted to point out the USDA National Hunger Hotline, which is listed at the top of the slide here. As you can see, there's a number for English and for Spanish. The operators there can steer callers to all of our programs, including WIC, and they'll interview, and depending on the situation, we'll direct the caller. So if you could please share that number, especially if you suspect food insecurity. And the other resources are from SNAP and Summer, and of course our homepage. And with that, next slide, thank you very much. You have my email address, and I will turn it back to Monique or to Hannah.
Thank you, Gary. Yep. So thanks, Gary. I'll wait just a minute until we get the other slides up, but thanks for that overview. And I'm going to just make a couple more comments about WIC generally before moving on to the National WIC Association and some of our work and current projects.
And are you good? I think your presentation is up.
There it is. I just saw it. Thanks.
No problem.
So Gary did a big overview of WIC as well as some other programs run by USDA. So just a few more points about the program. WIC is science-based, and we have a prescriptive food package. We do a whole lot of breastfeeding support, and I'll include something else about that in a moment. Gary mentioned the Loving Support Program. That is a huge part of the breastfeeding support we do. And then nutrition education is a requirement for all WIC participants. And as importantly, we refer WIC participants to other health and social services as needed, including dentists, pediatricians, hunger programs, and other community services. So next slide, please. So this is just a basic chart showing the increase in breastfeeding since 1998. You'll see it went from just over 40% in 98 to 70% in 2014. This is the percent of infants on WIC that were ever breastfed. This is especially important and impressive when you consider that more than half of infants in the country are on the WIC program. Next slide, please. So I am representing the National WIC Association. I do communications for the association. We are a membership organization made up of WIC staff across the country. We represent all 90 state WIC agencies, 1,200 local agencies, and more than 10,000 WIC sites. The National WIC Association is the advocacy voice for WIC. We do education for WIC staff, including 3 conferences per year, several webinars. We have a leadership academy and other educational opportunities, and we provide ongoing support to WIC agencies. Next slide. So some recent NWA projects to make this a little more concrete is we have worked with local agencies to learn more about client experience. This has included journey mapping, lots of in-depth conversations, and much more to get a better sense of how clients feel throughout the whole WIC process. We connect WIC staff to researchers, so there is a lot of research happening about WIC, and we help connect researchers to WIC staff and kind of guide that process and try to make it easy for, or as easy as possible for all parties involved. We are doing a national recruitment and retention campaign, which will be the focus of the bulk of my presentation, so I'll get into that in a moment. We have 2 registered lobbyists on staff who keep a very close eye on what's going on with WIC policy. We also launch advocacy campaigns for our membership, and we partner with other organizations to advocate for the program more broadly. Through a grant from the CDC, NWA is a granting and technical assistance organization for 34 local WIC agencies currently. These projects build community coalitions to improve health of mothers and children through policy, systems, and environmental changes. Many of these projects have focused on increasing access to healthy foods and beverages and increasing breastfeeding support. So this list is by no means a complete rundown of everything we do in the office, but it gives you a good sense of some of the big projects we're currently involved in. So next slide, please. So I'm primarily going to talk about this national recruitment and retention campaign. Recruitment and retention is a really big topic in WIC these days. Caseload has been steadily decreasing over the last few years, and there's a lot of research looking at why, as well as many projects trying to address this problem. At National WIC Association's annual business meeting in May 2015, voting members of the association decided to do a national advertising and outreach campaign. We spent the next year preparing for the campaign and participating in discussions with WIC staff and WIC families every step of the way. We are partnering with Meredith, the largest producer of parenting content in the United States in both English and Spanish. You may know Meredith from Better Homes and Gardens, Martha Stewart Living, Parents, Fit Pregnancy and Baby, Ser Padres, and many other publications. So what is this campaign? What are the goals of the campaign? We want to bring more families to WIC. We know we're not reaching all eligible families. We want to keep families on WIC longer. There tends to be a drop-off when a child turns 1 year, and so trying to keep kids on through the full eligibility period until they turn 5. And we want to improve the overall public perception of the program. Next slide, please. So that's kind of the background on how this came to be, what the goals are, but what is the campaign? It is a 3-year multi-platform campaign, including advertising in physicians' offices, in maternity wards through welcome baby packets, print ads, digital ads, and a fairly strong local activation toolkit. So when we started planning this campaign, one of the big obstacles that became very noticeable is that there is not a WIC brand. There are dozens, if not hundreds, of WIC brands. So we spent the first several months of our planning last year branding WIC to create a stronger sense of identity and unity to drive the campaign. We are really excited that so many locals and state agencies are adopting the new visual identity and the brand voice. And I will share the new logo now. So can you go to the next slide? So this is the WIC logo that was created as part of the rebranding. And the next slide, please. And then some variations on it. We do have logos made for every state that is participating in the campaign, and local agencies are also able to request logos if they would like. Next slide, please. So just some quick information about where we are now. We are in the midst of a digital campaign. The campaign ads launched the week after Thanksgiving last year. So these are done as banner ads on the internet as well as more targeted ads through social media. Excuse me. And also a search component. So if you search for WIC or any of the services that WIC provides, WIC ads will come up. Excuse me, sorry about that. Much the same way that if you search for a pair of shoes at Macy's and those shoes follow you around for what seems like forever, that is what we're doing with WIC. So if you see one of these ads and you click on it, it will take you to signupwic.com. And once you're there, it gives some very basic information about the program and provides a space for you to put in your zip code, and the nearest WIC clinics will show up. Our goal with all of this is to get people from seeing an ad to making an appointment in as few steps as possible. So all digital ads are clickable to go to that Sign Up WIC website. In the next few months, we'll be launching some new ads on Facebook that are click to call. So if you click on the ads, it will automatically call a 1-800 number that will then prompt you to put in your zip code and will automatically redirect you to your nearest clinic. We have print ads in all of the national parenting magazines. If you see Parents or Ser Padres on newsstands, pick it up and flip through. You'll find a WIC ad in there. These ads have a 1-800 number that can be called. It works just like I just mentioned with the click-to-call Facebook ads. There's also a short code to text where you can put in a zip code and it will respond with the nearest clinics, or there's also the website that is also listed there. We have point-of-care advertising that went live in the last several weeks. We have a network of providers all across the country who are receiving some mini magazines about WIC that have very basic information about what the program is and encouraging people to take action and make an appointment. Starting later this year, we will be doing some outreach directly to healthcare providers. So we will be advertising in trade publications, including the AAP magazine, Contemporary Pediatrics, and others, to help educate providers about WIC as well. We know that when providers know about WIC, they love it and support it and encourage their patients to get more information, but we have a bit of a knowledge gap in making sure that all providers do know about the program. You can go to the next slide. I did just mention all of that, so we might as well go on to the next one. So now that the campaign has been live for several months, we're able to do some pretty in-depth analysis of what ads and what messages are working. So we have ads that promote the free food. We have ads that promote breastfeeding support. The ads that have been most successful by far are those that empower moms. So messages that tell moms they are great, they're doing a good job, and are really making moms feel good about their jobs as moms. So next slide, I'm just going to show two examples of the digital ads that are performing best. So be the mom you want to be, and then the next one is we help moms rule. So both of these are strong messages for moms. Can you go to the next slide, please? There we go. So I know this is a lot of information, and you may be wondering what you all can do to help this. If you know people who are wondering about WIC or looking for WIC, direct them to signupwic.com. We also have a local activation toolkit, which I have not mentioned yet. This is a toolkit that we shared with our members so they can work on amplifying the campaign through their local work. The toolkit includes logos, art files, and ads that can be placed in local or regional media. And it also includes Facebook posts for each week of the year. We are releasing those quarterly so that we can stay relevant and on top of current trends. And we have those available. So if you are interested in helping with that portion of the campaign, please feel free to get in touch with me, and I can share those social media files with you. And then refer people to WIC. If you hear someone who you think could benefit from WIC services, please tell them about the program. Next slide. I now just have a couple of examples of some of the assets we've created as part of the campaign. So this is a trifold brochure we've created and shared with our members so they can use it in their local outreach as they go to coalition meetings or talk about WIC with other community partners. There is a space for including the local clinic information there and easy contact information. Next slide. And this is just an example of one of the ads. This was running in Parents Magazine and a couple of others. I think it's even in some of the magazines that are currently on newsstand. And finally, the last slide is just my contact information. So if you have any questions or want to hear more about this program or how it's working, please feel free to get in touch with me. With my email and phone number, I'm happy to answer any questions you have.
Great. Okay. Well, thank you, Hannah. So I'm Jill Panichelli. I'm from Share Our Strength. I'm going to talk a little bit about Share Our Strength and the No Kid Hungry campaign, and then I'm going to talk specifically about the work that we have been doing in WIC these past few months. So next slide, please. So Share Our Strength, our mission, we are a national nonprofit organization, and our mission is to end childhood hunger in the United States. We are trying to get all kids the healthy food that they need every day. Next slide. Okay, so we do that in 3 ways. We have 3 ways that we approach ending childhood hunger. So one, we're trying to increase access to and participation in the federal nutrition programs that are available to families. So in particular, Share Our Strength has looked, has done a lot of work very closely in the school nutrition programs, the underused school nutrition programs. So school breakfast, summer meals, like Gary was mentioning, after school meals and snacks, and increasingly, we are taking a look at other programs as well, such as which we'll talk about. So we're increasing access and participation in those programs. We're also we also have a program called Cooking Matters, which empowers families with the skills and knowledge that they need to shop for and prepare nutritious meals on a limited budget. So we want to make sure that outside of school, kids have healthy foods as well, and that their families are prepared to cook those on the food dollars that they have. And then 3, we're also driving awareness of childhood hunger. We do advocacy and are working to engage the public and become more committed to this issue. Next slide. So how do we get involved with WIC? So since our mission is to end childhood hunger in the United States, clearly by only focusing on the school nutrition programs, we're not going to be able to end childhood hunger for all kids. So we started to also take a look at the programs that are focusing on the preschool ages. And WIC is just an outstanding program. There's an incredible body of evidence, which Gary also talked about, showing improved outcomes for infants and children when families are participating in this program. It's a little hard to see here, and this is probably an outdated infographic, but you know, WIC does a great job in terms of reducing premature births, infant mortality, low birth weight, anemia. WIC participants are more likely to receive well child care. There's just a ton of connections between WIC and better health outcomes, and so we know that this program is going to get kids this age the healthy foods that they need to grow and thrive. Next slide. So, you know, another reason that we wanted to focus on WIC is because similar to the underused school nutrition programs, there is a participation problem in WIC. So there's an opportunity here to get 5 million more kids the nutritious foods that they need. So you can see that there's about 6.5 million kids, eligible kids that are covered by WIC, but about 5 million that are eligible but not covered. So that's a lot of children who could really use this incredible program. Next slide. So what's happening here? WIC is serving 84% of all eligible infants, so it's really doing an incredible job getting moms and their babies into the program, but there's a retention issue. So as children get older, you can see this graph, as their age increases, the percent that are covered decreases dramatically, so that by 4 years old, only roughly 1/3 of eligible 4-year-olds are participating in the program. And when you combine and look at ages 1 through 4 together, only about half of eligible children are continuing on the program. You hear a lot of reasons, in the literature, and there's been a lot of focus and study on this. So, the value of the food package decreases, relatively. So if you're getting formula is very expensive. After 1-year-old, the value is not quite as great. If you're breastfeeding, that support, may not be needed as much. Moms are busy. They have competing priorities. There's all kinds of issues that are going on here that you hear about. And what Share Our Strength wanted to do was take a look at everything that's out there and that's been done and been studied, and add to this by talking to the moms themselves, and not just doing sort of focus groups and asking them what their barriers are and things like that, but actually bringing them into the solution of the problem and having them be the ones to help design what does a better WIC look like to you. Next slide. So this was the question that we moved forward with. How might we ensure that all eligible children stay on WIC until age 5, preparing them to enter kindergarten healthy and ready to learn? Next slide. Okay, so we started this work in the fall with some moms in Fairfax County, Virginia, and there were a couple of sessions that we worked with them on, where we engaged them in different exercises and different co-creation exercises. Part of this was around understanding how they interact in their communities, where are the places that they're going, and then also understanding how WIC fits into that picture. How does it fit into their lives, their everyday places that they're going and not going, their normal daily routines. So that was our first exploration. And then our second piece of this was the actual co-creation. So we had the moms themselves ideate on, what would you do to create a WIC program that you want to stay in until your child ages out of the program. Moms were brainstorming all kinds of ideas. You can see in the lower left-hand corner, this is they put all the ideas on the wall and were walking around and then voting on the ideas that they liked the best. Then we had them move on to taking the ideas that they voted on that they did like the best and build those out into concept posters. So on this picture here on the right, they're building out a concept poster where they are drawing out what does this idea look like to you? What are the top 3 features that you would have to include in this idea in order to make this really successful? And then they did presentations on the ideas. So again, the idea here is that we are trying to give moms a voice to let them say, this is what I want in the program. And so it's not just understanding what their barriers are, but really bringing them into that process. Next slide. So from the first part of the work, where we talk to them about, what their lives are like, what their communities are like, what they value in the WIC program, what they would want to see in an ideal WIC program, we use those to create some personas. So we sort of categorized, amalgamated and categorized the moms into these 3 categories of, the new mom, she's very new to this, she values the information that she's getting from WIC so much, the breastfeeding support, understanding how to transition into solid foods, things like that. This is all very new to her, and the information that WIC is giving her is incredibly supportive and valuable. The experienced mom has done this before, and she may not need quite as much hand-holding as she did at the beginning, but she requires a lot of respect. So she wants, at a minimum, she wants the WIC clinic to be clean, to have toys there for her kids to play with when she's there. She wants, people to make eye contact and say hello when she walks in the door. She wants to be respected, and that's why she stays, when she feels that connection with the staff and that she is a valued mom. The former WIC mom is a little bit different. So the former WIC mom wants that respect, but also really needs the convenience. So she's a busy mom, she's working, she has other commitments, and as much as she may want to spend a bunch of time at the clinic, she doesn't have that time available to spend there. And so for her, things that make the WIC experience more convenient are extremely important. But she left because she didn't feel as though she was getting some of those things that she needed. Next slide. Okay, so what do we do about, to make those former WIC moms stay on the program? How do we make sure there are much fewer of the former WIC moms and much more of the veteran WIC moms? So these were moms' ideas. You can see they brainstormed a ton. These moms were incredibly creative and not hesitant at all to share their ideas. It's a little hard to see here, but we grouped these into categories, and by far, the biggest themes here were: 1, using technology in order specifically to make fulfilling those WIC requirements easy or easier. So, we hear so much that the moms, these are millennial moms, they're using their cell phones in their day-to-day lives, they're doing everything by text, and they want to be able to do that with the WIC program as well. So that's how they want to interact by and large, but WIC is not necessarily set up to enable that to happen very easily. And then flexibility. So, they want to be able to reschedule appointments easily. They talk a lot about, we're moms of young kids and we have things come up and we need that flexibility within the program to be able to work with us and our young families. You can also see, not very clearly, but there's ideas that are here in purple and in green. Those are the ones that the moms voted on most highly. So the purple, they voted very highly. The green, they voted very highly, and then also chose to develop into those concept posters that I was showing you earlier. In terms of the specific ideas, so a couple of them that they built out into the concept posters: online scheduling and rescheduling, kiosks at the clinic to be able to check in and start to update their contact information and upload their paperwork and do those sort of administrative things without having to interact with the front desk and have to keep going up and down. Measurement checks at the pharmacy, so that they listed as a very convenient place in their community, so that they didn't have to bring their kids to the clinics for those measurement checks each time. Kiosks at the store where they could check their balance and be able to locate where those WIC foods are. Mobile WIC. So these are just some of the ideas, and some of them are also indicate some potential policy changes or things they would like to see. For instance, more money for fruits and vegetables. Next slide. And then I did want to point out, this is obviously a very small sample of moms in one location of the country, but what we did as well was we worked with APCO Insight to do a survey of 1,000 WIC eligible caregivers to, which really validated those findings. So the survey surveys them about a lot of different early childhood issues, but we asked some questions specifically about WIC, and interestingly, 4 of the top 5 selected features. So we asked them, if you could create your dream WIC experience, which features would be most important to you? And 4 of these top 5 features map directly to the ideas that were selected and built out by the Virginia moms. So we saw a lot of overlap here, and again, echoing these themes of convenience, flexibility, technology. Next slide. So we took all of this information, so the great ideas that we got from the moms, from the national survey, feedback from experts from national, state, local organizations working in WIC, kind of took all of this and filtered it through some tests of our goal is to put some pilot tests into the field, and so to determine which ones of those we want to move forward with, which of these ideas do we feel like have the strongest legs to move forward. We kind of filtered that through the lens of what seems scalable, what's feasible, that type of thing. And from that, we have come out with 2 pilots that we are moving forward with this year. So one is an online scheduling pilot. So we're working with a state WIC agency to open up online scheduling and rescheduling ability to a couple of districts in their state first. So trying it on a very small scale and understanding what type of impact that has. Does it actually create more flexibility for moms? Do they value that? Are they more likely to keep their appointments when they're able to have that flexibility in scheduling? So taking a look at that, and then ideally being able to roll that out statewide and promote that nationally if that is found to be successful. And then an online grocery pre-ordering pilot. So we're working with a national retailer to pilot in one store. The ability to pre-order the WIC foods online, not paying for it online, that's not currently allowed, but selecting the foods, having them pulled in advance, and then going to the store to pick those up. The advantage of this, because WIC is a supplemental program and it's a fairly small set of foods, it's certainly not enough to cover all of their shopping. So the idea is that they have to go to the grocery store anyways to do other shopping, so they can schedule that pickup for a time when they're going to go grocery shopping anyway, put that in their cart, and then go ahead and do the rest of their shopping. We think the advantage here is that even in states that have already transitioned to EBT, and some states are really good about providing apps where they can scan on their phones and identify the WIC foods. However, when I have my screaming 2-year-old in the cart, that's still pretty hard to do, right? So we think that this will reduce a lot of barriers for the moms to be able to do that in the comfort of their own home, when maybe when everybody's in bed already, to pre-order those foods and not have to worry about some of the challenges of identifying WIC foods at the store. We also hope that it will be seen sort of, online grocery ordering is seen sort of as a premium service. So does this provide, a sense of empowerment and value to the WIC mom? And then, of course, we'll be taking a look at, from the business perspective, does this make sense for the retailer? Because, of course, if this is not a financially viable plan for them, then it ultimately is not scalable. So our hope is that this will be something that benefits both the moms and the retailers, and will be a win-win for everybody. Next slide. Okay, so that's it. And I'm sorry I did not put my contact information on this slide, but if you need to reach me, I am at jpanicelli@strength.org, which is probably very hard to spell, but you can also reach out to Monique afterwards, and I'm sure she can put you in touch. Thank you very much.
Perfect. Thank you guys so much for presenting. At this time, if any of our attendees have any questions, I don't see any right now, but I'll give you this time to ask those questions of our panelists. They'd be happy to answer any questions that you have. So I'll give a couple minutes to you guys to type those into the question pane before we end our webinar. So hang tight. Cheryl asked if we can have copies of the slides. Just a general announcement, the slides will be available for download, and the webinar is being recorded, and that will also be available for viewing on the Root Cause Coalition website a few days after the end of this. And the Root Cause Coalition website is www.rootcausecoalition.org. It seems you guys were very thorough in your presentations. No one has any questions. Oh, I have one moment. Lonnie asks, how can men contribute to these efforts?
This is Hannah with the National WIC Association. So men can be involved, dads can be involved in a number of ways. If you are a parent, if you are a dad, you can be supportive of breastfeeding, as an example. If your family receives WIC benefits, go along to the WIC appointments as often as you are able to. As far as the national ad campaign that I talked about, you can participate in any of those actions that I shared, such as promoting WIC, telling people about WIC, encouraging people to seek out WIC, and if you're active on social media, sharing about WIC on there.
Yeah, and this is Jill Panicelli from Share Strength, and I would just add to, I spoke a lot about moms, and that is who participated in our sessions. And you know, I think they are probably the majority group of who's, you know, coming to the WIC appointments. But having said that, you know, there are lots of dads who, you know, who bring their kids in for the appointments and who are doing the grocery shopping with the WIC checks and things like that. So, you know, it is probably a better and more inclusive term to say, you know, the caregivers and not just the mom. So what we're trying to do is also, you know, test retention of the children. And so, you know, and whichever parent that is who, you know, who keeps them on the program, obviously moms and dads are both highly participatory in that.
Do any other attendees have any last questions for our panelists? Okay, well, the contact information for our panelists was on the screen, and just a reminder that Jill's contact information is J Pinicelli, her last name, which is on the screen right here at, is it shareourstrength.org, Jill?
It's actually just strength.org, so strength.org.
Perfect, okay. Well, if any of our attendees have any questions for our panelists, feel free to reach out to them or myself. I'm the manager of operations here at the Coalition. My name is Monique Brigham, and my email address is mbrigham@rootcausecoalition.org. Thank you so much for attending this installment of the Root Cause Coalition's webinar series. And at this time, I'm going to end the webinar. Thank you so much, everybody.
Thank you.
Thanks. Bye-bye.